Hi, everyone. Welcome to this virtual pharmacy school fair workshop. My name is Stephanie Madrigal with AACP, and I'll be moderating this session. We'll soon get started with today's session, which is exploring pharmacy career paths from STEM interest to community health impact in just a moment. But before we get started, I wanted to begin with a few housekeeping items. Although you will be muted for the session, please feel free to ask questions through the Q&A window, and throughout you can ask those questions throughout the webinar. We have set some time at the end of the presentation to address any questions you may have. If there are any questions that we don't get to, we invite you to stop by to speak to the speakers. They'll be available in their booths during the expo hours from 5 p.m. to 7 p.m. Eastern. So we highly encourage you to visit them and talk to the speakers that are in the virtual booth at that time. Additionally, this presentation will be recorded and available immediately after in the Sessions tab. Now I'll go ahead and turn it over to our speaker to get started.
Thank you so much, Stephanie. Hi, everyone. My name is Olga Aurora Rodriguez. However, most people know me by Aurora. And you'll get to hear a lot about myself. But my current position is the Executive Fellow at the NACDS Foundation. So thank you all so much for joining the session today. And throughout this presentation, I really hope to highlight my personal career path that led me to my current position with the foundation. Also share a bit about what we do as an organization, outline some steps that you can take to pursue a pharmacy career. And also, like Stephanie said, please feel free to ask any questions along the way. So let's get started. So, going over what we'll be covering today, by the end of this session, I want you to walk away with three things. First, you'll be able to explain the value of a pharmacist, not just what pharmacists do day to day, but what our role and why it really matters to the broader healthcare system. Second, you'll gain a clear understanding of different pathways in pharmacy. And thirdly, most importantly, you'll leave with actionable next steps that you can take to start exploring a career pharmacy. So with that roadmap in mind, let's dive in. So why pharmacy? Let's start with a few reasons why this field really stands out. First, there's the financial stability. Pharmacy really offers a strong earning potential, which is a practical consideration for anyone really planning their future. But beyond the paycheck, pharmacy sits right at the intersection of science and patient care. So you're applying chemistry, biology, clinical knowledge every single day directly to improve people's health. Then there's healthcare impact. Pharmacists are one of the most accessible healthcare providers. Patients can walk into any pharmacy without an appointment and get expert guidance. And with that, I wanted to kind of note the stethoscope icon on the slide to help you think about the clinical side of things. The field is constantly evolving with expanding roles like in immunization, um, chronic disease management, and also public health initiatives. So those are the whys. Now let's talk about the how. So next, we'll be walking through the pathway of what led me into pharmacy so you can see a real journey of going into a field like this. So as you can see from the graphic on this slide, there's a general progression that leads into the pharmacy's career: high school, college, pharmacy school, and then a professional role. And at the bullet points at the very top reflect my personal journey going through this progression. It all started in high school when I first was gravitating more towards STEM courses, more than anything. So, like math, science, biology, those are really the subjects that genuinely excited me when I was going to school every day. I didn't know yet that pharmacy was where I'd end up, but those early interests in STEM courses really got me to think about it and were the foundation of what everything came after that. In my undergrad, I really leaned once again in those passions and pursued a dual academic foundation where I got a bachelor's degree in science and biology and a bachelor of arts in chemistry. So that combination really gave me a strong scientific background and prepared me for the rigor of pharmacy school, which I'm really grateful for. Um, but what really opened up the door to pharmacy as a career option was really the early exposure that I got both in high school and college. I participated in STEM summer programs that included shadowing experiences. And so those programs really gave me a first real look into two key pharmacy settings, which included hospital pharmacy and community pharmacy. Being able to really see pharmacists in action in both of those environments helped me understand the profession, but also confirmed that that was the pathway that I wanted to pursue. So the key takeaway here is that there's really not like a single right path to pharmacy, but curiosity and exposure are, ways to open those doors. So next, I'll kind of continue this story into pharmacy school and where those things really kind of started taking shape. So, continuing into pharmacy, after building that academic background in undergrad, I started during my time in pharmacy school. I was exposed to a wide range of experiences that really helped me figure out where I wanted to go. During my rotations and electives and involvement in student organizations, all really played a big role. And so I would really encourage all of you to be open-minded during that stage and then also following as all those three sections, undergrad, pharmacy, and then post-professional school. I'd really encourage you to take advantage of every opportunity that you can to explore different practice settings, whether it's retail, hospital, research, or something less traditional like association work. Each of these experiences will really help you narrow down what excites you the most. And remember that pathway, once again, is not linear. Many pharmacists pivot from different settings in their careers. And just to kind of highlight what is being shown on this slide, as I kind of mentioned, that general progression starts from high school, undergrad, pharmacy school, and then post-grad, sometimes even immediately after graduating, you have um, professional roles. But to kind of summarize right now, there's so many various different changes happening in pharmacy schools. For accelerated versions, you can take 3 years in pharmacy school. The more traditional version is 4 years long. And then if you have a little bit of extended time, it can be up to 6 years. And then residency and fellowship are postgraduate opportunities that help you really specialize in any section that you'd be really interested. So, for example, usually the first year of residency is more clinical based, so you're probably doing a very general rotation at a hospital. For fellowships, it's usually like pharma, or in my case, it was association management. But there's also 2 year options for both of those and gaining more understanding in even more specific area or just getting more exposure to fields that may require that additional year. As you can all see from the graphic, there are various potential career paths within the realm of pharmacy. So most people don't really learn about the potential career options until they're really in pharmacy school or even after pharmacy school. So in my case, I learned about them during my time in pharmacy school. My first exposure of them was really during my first year orientation course. And then I got to learn a little bit more about pharmacy organizations. Sorry for that. Pharmacy organizations. I apologize. I lost my train of thought for a second. Um, My first exposure was during pharmacy school and after my first orientation class. Then I learned about them through my organizations and professional development opportunities I had in my first 3 years of pharmacy school. Of note, some of my peers had internships that were specific in like oncology or radiology and that type of thing. So it happened during their first 3 years of pharmacy school. So those are potential opportunities as well. In my case, during my third and fourth year of pharmacy school, through electives and rotations, I was able to gain exposure to association management realm of pharmacy. And so this kind of allowed me to learn about associations, which included NACDS and NACDS Foundation. Now that we've kind of seen the full map of the career path in pharmacy, I wanted to zoom in into one particular that is the most common and impactful setting, community pharmacy. So this is where many pharmacists begin their careers, and it's also the setting most people are familiar with. So as you can see from the graphic on this slide, community pharmacy really is a team-based healthcare. It's not just one profession working in isolation. So it's a collaboration of effort where pharmacists play a really central role alongside so many different healthcare professionals, and most importantly, alongside patients themselves. So, who are pharmacists collaborating with in this setting? First, there are the physicians. Pharmacists really work closely with doctors on medication decisions and safety. Things like checking for drug interactions, recommending dosing adjustments, and ensuring prescribed therapy is appropriate for the patient. Nurses are also along that line who work on handling medication administration, patient monitoring, education. So pharmacists and nurses are really working constantly to communicate to make sure patients are receiving the right care of treatment. And then, of course, there's also the patients and their caregivers. So this is where community pharmacists really shine, I think. Pharmacists are often the most accessible healthcare provider, which I feel like I've chimed so much throughout this presentation, but it's so true and impactful. So understanding their real world needs of the patient or the healthcare provider, like medication adherence, their lifestyle challenges, personal healthcare goals, is really essential. One key skill that ties all of the things that I just mentioned is communication. So, as a pharmacist, you're going to need to be able to explain medication knowledge differently depending on who you're conversing with, who you're collaborating in that moment. When you're speaking with a physician or a nurse, you're using more of those clinical terminologies and discussing more in depth of the medication itself. But when you're talking to a patient, you need to break it down into clear, everyday language they can act upon. So you have to have the ability to be adaptable in your communication skills. So that's really one of the most valuable skills you can have as a pharmacist and develop over time for sure. So that's community pharmacy in a nutshell, team-based, patient-centered, and deeply collaborative. Next, I want to show you what different kind of pharmacy careers that might you may have not heard of, and that's it at the interaction of research and education. So NACDS, or the National Association of Chain Drug Stores Foundation, is a 501c nonprofit organization. The foundation really focuses on public health and patient outcomes, which is a little bit different than our NACDS trade side. The foundation really isn't looking too much into the role of pharmacy itself, but we emphasize how important pharmacy is in the advancement of public health. So the two focuses that we usually look at are two pillars, research and research and education, which enhance healthcare outcomes, foster equity, strengthen access, and also advance public health. So the primary focus is our research portfolio. Important to note is that we don't really conduct the research ourselves. We're working with other entities, primarily universities, who are conducting that research, and we serve more of a facilitator and manager. Um, and the foundation supports this community pharmacy research to enhance public health, healthcare outcomes, and public health is essential because seeking innovative ways that community pharmacists can become close patient care in closing those patient care gaps. Some of the current projects, just to mention a few that we're working on right now, are related to HIV prevention, childhood vaccines, and opioid misuse and prevention, which is what we're working on right now overall. The foundation, on the education side, we work on focusing on initiatives like scholarship programs, which are usually awarded during our annual meeting, and where we provide scholars to universities to fund their projects that address a need in the community, patients, and anything along those lines. And within education, we have two specific tracks. The innovation track, which is projects that showcase novel patient care, and then also diversity and inclusion track, which really promotes pharmacy and showing students that are in pharmacy is an option. The foundation also raises money for the research and education initiatives. We also provide awards such as the Excellence in Patient Care Award to anyone who has advanced public health. And this is not only an NACDS Foundation interest, but we also work on also other charitable organizations who have very similar goals and missions that align with our overall purpose as well. The NACDS Foundation has big supporters like March of Dimes and also overall many other organizations as well. So we've talked about why is pharmacy a great field, walking through my personal pathway, but also exploring a wide range of career options, and also then kind of focused in community pharmacy as a close-up. And then now we're going to learn what can you do? How can you actually start exploring these pathways for yourself? And that's what this slide is all about. So first, trying to shadow in different settings, pharmacy settings, of course. I mentioned earlier my personal experience of summer programs that really allowed me to gain that exposure to hospital and community pharmacy. And that experience was really a turning point for me. Whether it's a community pharmacy, a hospital, a clinic, shadowing really lets you see that day-to-day reality of the profession and figure out which environment really resonates with you. Another idea that I want to give y'all is be strategic with your electives, be it in undergrad, be it when you get into pharmacy school. Electives are really a great way to test your different interests, whether it's a specialty clinical area, if it's healthcare leadership, or even health policy. Another point is joining a student organization or even taking a small leadership role. This is one of the best ways to build your network, develop professional skills, and get exposure to areas of pharmacy you may not have encountered in the classroom. It doesn't have to be really a huge commitment, but even organizing one event or serving on a committee can really make a difference to gaining those different non-classroom skills. And then fourthly, you can practice your communication skills. We talked about this on the community pharmacy slide, so being able to explain a topic in two different ways. One way maybe to another fellow healthcare provider, and then one to a patient, or you can just do it to the general public, but just practicing trying to say things in different ways. It doesn't have to be anything even medical related. So practicing this informally can definitely become a strength later on. And finally, asking professionals questions. So reaching out to pharmacists in different roles, asking them things like, what does your day-to-day look like? Or what surprised you most about your career? You'd be really amazed how willing people are to share their experiences and their conversations. And those can really open up doors that you don't even know exist. So I really, really highly encourage this particular point because once again, it was something that helped me along the way and got me excited, but also allowed me to see so many different fields in pharmacy that I didn't know or had considered in the past. So the big takeaway here is that it's not just one right path, but curiosity and exposure can open so many doors. So I encourage you to take that first step, whatever it looks like for you. And with that, I'd like to open up things to hear what you'll have for me.
Great. Thank you so much for this wonderful presentation. We do want to remind all of our participants to go ahead and submit your questions. Either you can send them in the chat or use that Q&A box, and we will love to answer those for you. So we just received a question that says, what made you want to be part of NACDS?
There's so many facets to that question, but I think to start out, Um, my first exposure to the organization was past fellow, two past fellows to be very specific. So even before I knew about the organization, I was part of a pharmacy student organization called SNAFA. So once again, chiming in on one of the points that I mentioned towards the end, being active in organizations. I conversed with that fellow when I was in my second year of pharmacy, if not early third year, and they were the current fellow at the time, and they were just working whatever their position was at that organization, and I was working mine. So it was just kind of like an informal, just friendship overall. And then they kind of mentioned, oh, I'm moving on to this position after I graduate. And I was like, awesome, everyone's finding out their information really close before they graduate and everything. And it was just an awesome moment. And it was just kind of like in the back of my head. I didn't really give it much thought, to be quite honest. And then the very next year, when I was in my last year, I attended one of the um, virtual expos that, once again, SNAPA, which is a minority pharmacist organization, um, during my fall fourth year. And I met the current fellow of last year, who was also someone that I had kind of rubbed shoulders indirectly through the organization of SNAFA. And so, of course, through this particular event, I was able to learn about what the foundation does, what the particular position that they offered would offer me as someone who is a pharmacy postgraduate to be. So I guess kind of like in general, that was my very first way of getting to know and why I joined NACDS, but specifically the foundation. But secondly, I think it was my interview, my interactions, the environment, the feeling that I got from the interviewers was very kind and warming and welcoming. And that's definitely been very true. I'm very thankful during my experience right now with my fellowship being a year long. There hasn't been any issues of like um, you know, I've always had someone to lean on. So that, and then most importantly of all, when I was doing my research before coming into the interview, of course, getting to see what their objectives were, what their future objectives were. And right now, as a fellow, I'm currently working on what those quote unquote future items were. So it's really fun and interesting to see now how I've become part of that plan that I got to see, oh, is going to be in the future. Now I'm participating in making differences in public health by activating, if you want to say, and brainstorming how we're going to make those strategic ideas into actual projects in the future. Thank you for the question, Kevin.
Thank you. Any additional questions? Now we can go ahead and close out the session. I want to thank our attendees for participating in this session. And again, as we mentioned during the introduction, if you have any additional questions that you'd like to uh, and ask or receive answers for, feel free to visit our speakers during our expo hours today. It's 5 to 7 p.m. And again, I hope you'll all join me in thanking our speaker today for her time and insights. And please enjoy the rest of the day.
Thank
Thank
you
you.
so much. And just to chime in, if you aren't able to make it to the session tonight, please feel free to contact me via email or phone number. But yeah, I would really be happy to answer any questions you'll have for our foundation side. Thank you all for joining.
Thank you.